Hello, and welcome to Surgical Optimization Class 1. Here at the Vernon Jubilee Hospital, we'll be talking about what you need to know before you come in for having your hip or your knee replaced. We want to recognize and acknowledge that we are collectively gathered on the traditional, ancestral, and unceded territories of the 7 Interior First Nations. This region is home to 15 chartered Métis communities, and it is with humility that we continue to strengthen our relationships with First Nation, Métis, and Inuit peoples across the interior. This class will go over what you need to know about preparing for surgery, arranging for help, such as who will pick you up after surgery and care for you as you recover, and health changes that you can make to improve your health, such as dietary changes, weight management, smoking cessation, alcohol cessation, and dental care, how to control pain both before and after surgery, as well as managing common complications that can happen after surgery, such as constipation and blood clots. Before surgery, you will need to watch the Living Well physiotherapy prehab presentation to get ready for surgery. It's led by physiotherapists, and they go over exercises that you need to know about before coming in for surgery. You are at Surgical Optimization Class 1. This is the next class that you should be watching after you do Living Well. And after this class, there may be a bit of a time on the wait list while you are waiting for your date. The next classes we want you to watch closer to your surgery date once you're provided a date. Physiotherapy will want you to watch either the hip or the knee video closer to your surgery date. And they'll also be in touch with you about getting your equipment through the Red Cross. There will also be a surgical optimization class 2, and that you'll need to watch. And it's put on by nurses again to get you ready for surgery. And there may be also a phone call appointment with an anesthetist closer to your surgery date. Your anesthetist may also just speak to you on the morning of surgery. We're going to talk about the wait list. There are many factors that affect your time on the wait list. The first and foremost is the date of decision, and that's when you had the conversation with the surgeon to decide that you want surgery. The doctor writes the date on the form, and we receive that. The doctor will take into consideration the severity of limitations, your x-rays, and do an assessment of you. And medical optimization can also impact your time on the wait list. So that is things like if your blood pressure is high and it's not controlled, or if you have diabetes and your hemoglobin A1C is too high. Other factors that influence the time that we want to do your surgery at. Another factor that impacts your time on the wait list is the time in the OR that's available, the surgical time availability. And so that is designated by Interior Health. Each surgeon gets a certain number of days in the operating theater. They're not flexible. That date that they're given is the date that they're given. We have received some extra funding for 3 additional orthopedic days in the OR to try to reduce our wait list, which we've been successful with. Another thing that impacts your time on the wait list is the hospital capacity, traumas, and postponements on the day of surgery. So if there isn't capacity for you to have your surgery at the hospital, your surgery could be postponed on the day of surgery. And as far as patient availability, if you are going to be away for a great length of time, we do ask that you let us know. If you have travel plans coming up, we do our best to work with you as far as that goes. If you're going to be out of country, we would like to know. So we would like you to let our booking clerk know. I will give you the numbers at the end. We want to be able to accommodate when you have help and that sort of a thing. So if you have ideas around when your surgery would be best suited, you can let us know. We do have a mandate from the provincial government to operate within 6 months. We are doing our best to meet those guidelines. At this time, we are a little bit over for some surgeons. Each surgeon has their own wait list, and we do get a financial fine if you are on that wait list longer than 6 months. So we do try our best to give you a date within the 6-month mark. Another question we get is how long you will stay in the hospital, and the answer is not very long at all. For a total knee replacement, you will typically spend 1 night in the hospital. You'll need to pass physiotherapy, have your pain controlled, have your lab work and vital signs okay, have your x-ray done, have your antibiotics. If you're having a uni knee or a partial knee replacement, you may be eligible to go home on the same day of surgery, depending on your other health issues. As far as total hip surgeries, we've been using the direct superior approach. And with that approach, we have seen an improvement in how people are ambulating after surgery and how their pain is controlled. And we have been doing a lot of these surgeries as what's called same day discharge. So coming in for surgery and going home on the same day. Sometimes we do need you to spend one night in the hospital. You do still need to pass physio, have your pain controlled, have your lab work and vital signs okay, have your x-ray done, and have your antibiotics. We typically try to let you know if there is a chance that you could go home on the same day, or if we think you may need to spend the night. The anesthetist is a great person to ask if you have any questions about that. The number one thing we need to confirm with you for after surgery is who will support you after surgery. Your support person is an essential role in recovery after your hip or knee surgery. So we need to make sure that you do have somebody available for 72 hours after surgery, day and night. You must have somebody to stay with you. They need to be a responsible adult, somebody who can call 911 in case of an emergency, somebody who can drive you to the hospital or pick up groceries or that sort of a thing. It is difficult just to walk to the table holding a plate or a cup of water, so it just needs to be somebody who can help you. They don't need to have any medical training, and it doesn't need to be the same person. So you can have, say, somebody at night if they're working in the day and have different people during the daytime. We do request that you let us know if you're having any issues with coming up with somebody to support you after surgery. There are private pay options available through Interior Home Care Solutions. They were formerly known as WeCare. There's also Nurse Next Door, and there's a great resource at nexusbc.ca. They have an office here in Vernon, and they can assist you in finding private care to help you after surgery. You can also talk to your family doctor about what kind of supports you will need after surgery. We want to let you know that there are no home care services available for elective surgeries, which hip and knee replacement surgeries are considered. So you do need to have a plan in place before you come in for surgery. So after surgery, ICBC does not cover driving for new joints or after any major surgery. So we do need to make sure that you are aware you need to have the clearance of the surgeon before you resume driving. That can be up to 6 to 8 weeks after surgery. It depends on which joint you're having done. It depends if you're having a right knee or a left hip. It depends on your reflexes, how they are after surgery, your swelling, your pain, how your movement is going. The surgeon will need to assess you to ensure that you are okay to drive again. If you have to travel and ride in the car for any great distance, we want to make sure that you do get out of the vehicle every hour and walk around to decrease your chance of blood clots. When you're riding in the car, making sure that you're pumping your feet and ankles and engaging your calf muscles to decrease your chance of blood clots. As far as air travel goes, the surgeons recommend not flying for 6 to 8 weeks after surgery. If you do fly, there's a risk of having blood clots with the flying, and there's a risk of having blood clots with the surgery. So the risk of having a blood clot is just exponentially enhanced, and we want to make sure that you don't travel too soon after surgery. Please chat with your surgeon if you do have a trip planned, and your surgeon can help you figure out when is the safest time to travel. And when you do travel after this time, do still make sure you get up and move around every hour to help decrease your chance of getting a blood clot. We're going to talk about nutrition a little bit now, and that's because a healthy body supports healing and an effective immune system helps to fight off infections. We just want to mention that if you get steroid injections in the joint that you're having replaced, your surgeon will request that you not have an injection within 6 weeks of surgery. If you're a patient of Dr. Dooley's, he requests 3 months out. So if you are on the wait list to have surgery with Dr. Dooley, we do recommend checking before you have a steroid injection or postponing that steroid injection. You can get steroid injections in the other parts of your body, but there is an increased risk of infection if it's done too close to your surgery in the joint that you're having operated on. Okay. Now, if you do receive a phone call and you have had a steroid injection within that time frame, either 3 months or 6 weeks, then do let the booking clerk know, and we can adjust the date ever so slightly so that you can still have your surgery done, but at an appropriate time. We would also request that you complete all vaccinations at least 2 weeks before or 2 weeks after surgery. And that's for COVID-19 or for shingles or any other kind of vaccine. Flu vaccine needs to be 2 weeks before or 2 weeks after surgery. We're going to talk a little bit about some minerals that can help you after surgery and before surgery to include in your diet. Make sure that you have some calcium, vitamin D, and protein for healing. So the calcium and the vitamin D help as a building block for your bones, and that can help going into surgery, ensuring that you have adequate nutrition. It can help improve your bone health and decrease the risk of breaking bones. The protein can help improve your muscles, skin, and tissue and repair it. And it can help fight off infection and keep your bodily fluids balanced. As far as calcium and how to add that into your diet, think of white foods. So your dairy, yogurt, cottage cheese, chicken, turkey. That's where you're going to get your calcium from. As far as vitamin D, we typically get that from the sun. And when we don't see the sunshine, you can get it from orange juice, yellow pepper, egg yolk, squash, and yellow foods. And as far as protein goes, that is things such as meat, eggs, cheese, nuts, seeds, legumes, and beans. And down at the bottom of the screen, you're going to see a weird collection of words there, enhanced recovery after surgery. You'll hear us referring to this as ERAS, enhanced recovery after surgery. If you are having your hip replaced, then you will be on this ERAS protocol. And what that involves is we want you to have some juice on hand, so either apple juice or cranberry cocktail, and you're going to need to drink 2 cups at a certain time and 1 cup at a certain time. And we will let you know those times closer to surgery. For 2 days before surgery, we will also ask you to drink some high protein boost or ensure, and that's just to increase your protein for the 2 days prior to surgery. So you still need to eat as well as drink some high protein boost or ensure. We also want you to bring in some sugar-free chewing gum, and that is to help get your bowels working after surgery. So that's all part and parcel of this ERAS protocol. There will be other things that we do to help enhance your recovery after surgery and expedite your discharge. We're going to talk a little bit about iron in surgery. So iron is a key component of hemoglobin. So that's what carries the oxygen around in your blood. So you need iron to bind with the oxygen. And if you have low hemoglobin or low iron, you can have anemia, and that can make you feel tired. It can delay your recovery time, and it may mean you may need a blood transfusion or an iron transfusion. If you have not had any blood work done in the last year, or if you've been told that you're anemic, it is a good idea to have a talk with your family doctor to see if you need to have your hemoglobin checked. What can happen is once we do have a date for you, we do check your blood work. And if it comes back low at that time, your surgery will likely be postponed. So this is something that you can do while you're on the wait list, is have that talk with your family doctor to see if your hemoglobin is okay. Now, if your doctor requires, you may be asked to take iron tablets, depending on what the outcome is of these blood tests. And the iron tablets take 3 months to start improving your hemoglobin. So if that's the case for you, that's something that you can do while you're on the wait list to help decrease your chance of getting postponed. We're going to talk briefly about weight management. They talk a lot more about this in the Living Well class, but just to reiterate what they say, 1 extra pound of weight equals 4 to 6 pounds of added stress on your joints. You've got to keep those joints moving. Motion is lotion. We're going to talk a little bit about some vices that you might have. So, as far as smoking and drinking alcohol. So, with smoking and surgery, you can have delayed healing, an increased risk of infection. You may end up spending a longer time in the hospital. Smoking includes inhaling cigarettes, marijuana, and e cigarettes or vaping. So if you need to help stop smoking, please talk to your family doctor or your pharmacist. You can also visit quitnow.ca, and there are resources available to help you quit smoking. We do encourage you to cut back or decrease. There are medications, pills, patches available to help you quit. We do ask that you not smoke marijuana for 24 hours before surgery. You are not allowed to smoke on interior health property, and it is a very stressful time to quit if you do choose to continue smoking for your surgery. We do ask that you at least cut down a little bit and think about talking to your family doctor about quitting smoking. As far as alcohol in your surgery, we want to make sure that your alcohol intake is decreased before you come in for surgery. If you drink often and a lot, you can be at risk for withdrawal. So that is things like feeling nauseated, vomiting, shakes, confused. Some people I have seen crawl out of bed and fall and require further surgery. So if you are worried about your drinking, we do ask that you have a chat with your family doctor to come up with a plan to cut back on your alcohol safely. There is also a risk that your blood could be thinned, and it can increase your risk of bleeding after surgery, and you can have an increased risk of infection and possibly even death with that. Alcohol is processed by your liver, as is a lot of the medication that we give you for surgery. So we ask that you not have any alcohol 24 hours before surgery to help prevent the thinning of blood, and also to help your liver be able to process the medications that we give you on the day of surgery. So again, please chat with your family doctor if you think that you are a daily drinker, and they can help you come up with a plan to cut back on your alcohol safely. We're going to talk about some pain control strategies and when to use ice and heat. So ice can help reduce inflammation, pain, and swelling. We want to make sure that you never put the ice pack directly on your joint, making sure that you've got a towel or something between you and your joint, and leave the ice only 10-15 minutes, no longer. There have been incidences where people have gotten frostbite, especially on the new incision as that skin is healing. So don't leave the ice pack on for too long. But you can repeat that every hour if you need to. And while you're icing, it's a great time to elevate, making sure that if you've had your knee operated on, you're keeping that knee as straight as possible and it's well supported so that it can drain. There's also something that they make called a cryo cuff, and it's a cooler that has a tube, and you fill it with ice and water, and it circulates this cool water through this pad that wraps around either your hip, knee, shoulder. It can be used on all sorts of joints to help with pain. They are available for rent and for purchase. They are fairly pricey, but they do provide good relief. I've heard a lot of really positive feedback about these cryo cuffs. And if you want, you you can look into that. They are available through medical supply stores or on Amazon. You can look on there as well. And it's called a cryocuff is one brand name, but it's the same kind of idea of a cooler with this pad that circulates cold around. If you can't afford that, a bag of frozen peas with the towel, just make sure you have enough to cycle through so that you can do it every hour if needed. Now, as far as heat, I tend to use more on muscles. It can help to decrease stiffness, relax those tense muscles. If you're doing some physiotherapy and your thigh or your back is sore, that would be a good place to apply the heat. The same thing goes for heat. We don't want it too hot and we don't want it on for very long, 10, 15 minutes maximum, and make sure that you're not burning your skin. Don't apply heat if your leg is swollen or throbbing. We want you to seek medical attention. We would be worried about a clot or an infection in those instances. As far as pain medication, you may be on the wait list so long that you need to resort to taking pain medication. So, if you do, the pain medication can help relieve pain. It can help you to stay active. There are medications that can help reduce swelling, and this can all help you sleep, which in turn can help with depression and anxiety that comes from chronic pain. We want you to chat with your family doctor about your pain level. We use a pain rating system of 0 being no pain and 10 being the worst pain you can imagine. And you can chat with your family doctor using that sort of a pain reference, and they'll understand what you're talking about. It is important to talk to your family doctor before starting any medications so that they can go over the risks and side effects with you, as well as any drug interactions with the medications that you might be on. And as far as herbals and supplements, your family doctor will need to know about those as well. So we're going to talk about approach to pain control that we like to use. It's called a multi-modal analgesic approach. And basically that's a fancy way of saying we want to use a layered approach to pain. So these things can all be used together. So we're going to start on the far left here with your basic analgesic, and that is acetaminophen, also known by the brand name Tylenol. So acetaminophen and Tylenol are the same medication. It's important that you not exceed 4,000 milligrams of Tylenol or acetaminophen in a 24-hour period. Your liver is what metabolizes the Tylenol, and so if you have any liver issues, it is important to talk to your family doctor about your liver and if Tylenol is a good option for you. So make sure that when you're reading the labels that you're not exceeding 4,000 milligrams of Tylenol. There are often combinations of medications that they combination in with Tylenol. So make sure that you're not exceeding 4,000 milligrams in a 24-hour period. Once you have your base layer of Tylenol, that's when you can layer in the non-steroidal anti-inflammatories. They're also known as NSAIDs. So those are things such as ibuprofen or Advil, naproxen or Aleve, diclofenac or Voltaren, or Siloxib or Celebrex. So those are all under the category of non-steroidal anti-inflammatories. They help to reduce swelling. And so we will ask you to stop these medications 3 days before surgery. We'll remind you of that closer to your surgery date. If you have any kidney issues, these may not be a good option for you as they are processed by your kidneys. So it is important to talk to your family doctor if that is a good option for you. They can also trigger gastrointestinal bleeds. So if you've had ulcers, we also want you to chat with your family doctor whether this is a good option for you. But it can be a good option with your Tylenol and your NSAIDs layered together. That can provide a lot of pain relief. If you're taking the Tylenol and an NSAID together and you're still having pain, that's when you may need to resort to taking narcotics. Narcotics are things like codeine, tramadol, morphine, hydromorphone, or Dilaudid. And those are narcotics. Tramacet, as you see there, has Tylenol mixed in with it. So just note, if you get a prescription for tramadol, it may be a 50 milligram tablet, and if that's the case, there's no Tylenol in it. If you get Tramacet, there may be 37.5 milligrams of tramadol, as well as 325 milligrams of Tylenol. So it's important to talk to the pharmacist about your prescriptions so that you know what's in them, so you know what medications you can take and when. So we want to layer in the Tylenol with an NSAID and then a narcotic, which is available by prescription. So typically the surgeons give you a prescription for about 7 to 10 days after surgery. It's usually enough to help control your pain, but it is a good idea once you get your surgical date to make an appointment with your family doctor for about a week after surgery. Just in case you have any issues, you can discuss them with your family doctor. Or if you need any additional pain medications, that's a great time to discuss that with your family doctor. And if you don't need the appointment, then it's easier to cancel that appointment than it is to try to get one at that specific time for you. Now, as far as narcotics, once you start taking narcotics, there's a side effect as a nurse that I think about, and that is constipation. You are not going to be in the hospital very long at all, so I'm going to give you some tips and techniques to help manage constipation at home because you will need to be managing this on your own. So first and foremost, making sure that you're getting enough water. You need to stay hydrated. Making sure that you're eating enough fiber, fruits and vegetables and prunes, prune juice, having those things in your diet is really important. Exercise, getting up and walking around physically moves your bowels and gets them working again. And oftentimes with the narcotics that we give you, you do need to take a bowel routine or some medications. I'm going to go over a few suggestions. You can talk to your pharmacist about what they recommend as well, and I'll just go over what a few of them do. So Colace or Docusate is a really common stool softener, and what it does is it pulls water in the large intestine into the stool so it can soften the stool. So it makes the stool soft, but it doesn't make you go. So it makes it a little bit more comfortable when you do have to have a movement. So that's something that you can take. There's also something called polyethylene glycol, or PEG for short, also known as Restorelax or Clearlax. Typically, it's a purple bottle or a white bottle with purple label, and it is a really great daily preventative. It has a softener as well as a little bit of a bowel adjutant in there. It's a really good daily preventative, and you can put it in your water or your juice, and it should make you have a movement if you kind of start early. Senecot is a really gentle laxative. Sometimes it's so gentle it doesn't work. It typically doesn't cause any cramping. It usually takes a couple of doses for the Senecot to make you have a movement if you're feeling a little bit backed up, but a really great over-the-counter option. And then there's Bisacodyl. It's available in pill and suppository form as well. And that is more of a bowel adjutant. It doesn't cause any cramping. It usually takes about 8 to 12 hours for it to work. And sometimes you do require a second dose of that. And lactulose is available over the counter. It's a sweet, gross liquid, and it is quite strong. So if you're needing a little bit more of a oomph, a little bit more power behind it, lactulose may be something that you want to try. And of course, there's always the fleet enema. If it's been a few days and you've been doing all of these bowel routines and you haven't had any success, you may need to resort to a fleet enema, which is a bottle with a tip on it that has salt water in it. It's inserted into your bottom and you squeeze it. It's quite uncomfortable, but sometimes it's one of those things that needs to happen in order to keep the bowels moving. Ultimately, if you do a little bit of prevention, hopefully you can avoid having a fleet enema. So getting on your bowels sooner than later and doing all of these things to help prevent constipation is ideal. We're going to talk a little bit about blood clots now. So a deep vein thrombosis is a clot in your leg. And that is usually a sign would be redness or a change in color. Your leg may feel hot. You may notice a sudden increase in swelling or pain. And the hallmark sign that I want you to watch for is calf pain. That's worse when standing or walking. So when you're stretching that calf and you're having pain in there and your calf muscle that's tender to touch, that's when I want you to have your support person take you to the nearest hospital and get assessed for a deep vein thrombosis or a clot in the leg. Okay, really important that you're watching for these signs. If there is a clot there, and typically if it extends above your knee into your thigh, a piece can break off and it can go into your lungs. And that's called a pulmonary embolism, or a PE for short. And this can be life-threatening. You could feel short of breath, chest pain or pressure. You may have a new cough. You may cough up some blood. You can get pale, sweaty. Usually you'll have a fast or irregular heartbeat. Some people will have a sense of impending doom, and some people will faint or lose consciousness. And this is why we want you to have your support person for those 3 days. We do want to make sure that they're able to call 911 so that the ambulance can take you to the nearest hospital. So any kind of shortness of breath, chest pain, or pressure, we want to make sure that you get that assessed right away and go to the nearest hospital. You will be on blood thinners after surgery to help prevent getting a blood clot in conjunction with doing your foot and ankle exercises. We used to use an injectable blood thinner, and we were finding people didn't enjoy the injectable blood thinner. So the surgeons have moved towards an oral anticoagulant, or a pill, and you do that for typically 5 days or so, and then you'll transition on to a baby aspirin. So just follow your prescription and keep doing your foot and ankle exercises to help prevent blood clots and getting up and walking around every hour. Okay, if you're already on blood thinners, these will need to be stopped before surgery, and our internal medicine doctors and anesthetists will tell you when to stop your blood thinners. And after surgery, your surgeon will direct you about your blood thinners. Typically, you'll start them either the day of surgery or the day after surgery. We want to make sure that everybody knows about doing their breathing exercises. We want to make sure that you're taking lots of deep breaths. Your lungs are like balloons, and when you're not exercising them, they can shrivel up and shrink. So we want to make sure that your lungs, those balloons, stay nice and inflated. So making sure that you do lots of deep breathing and coughing exercises, making sure your belly is raising when you're taking those deep breaths. On the side of your screen there, you'll see what's called an incentive spirometer. And so that's the device there with the 3 balls and the tube. And on the end of that tube is a mouthpiece. So when you get given this in the hospital, we want to make sure that you use it a few times an hour. You'll be inhaling on that tube to raise the balls up, and that will help you to do your deep breathing and coughing exercises. Dental care. So we want to make sure that your health is up to date before you come in for surgery. So we want to make sure that you have a cleaning and all of your dental work is done before surgery. We want to make sure that you have a routine cleaning, and that can be done up to 3 weeks before surgery. Any closer and that can increase your risk of infection. There has been research that's shown a strong connection between any infections in your mouth or gums and also to joint implants. So we want to make sure that your dental health and dental hygiene is all completed before you come in for surgery. Any major dental work, so things like root canals, extractions, any reconstruction, that must be completed at least 6 weeks before surgery. If you have any specific questions, you can chat with your dentist and they'll be able to give you a good idea about if this is a risky thing to be done close to surgery. Your surgery may have to be postponed if you come in for surgery and there's obvious dental decay or infection noted. We also want to make sure that you do tell your dentist that you've had a joint implant. The Canadian Dental Association has guidelines around antibiotic use and having implants. They have recently, in the past few years, changed their guidelines to not giving prophylactic antibiotics before dental appointments, but that does change. So it is important to make sure your dentist is aware that you're having a joint implant. And we want to make sure that you do avoid dental work for 3 months after surgery unless you have an infection. Then it must be dealt with right away. It's the number one reason for having a joint infection is having a dental infection. So that's something that we want to avoid. Joint infections can usually cause a lot of pain and additional few surgeries, usually 2 to 3 more surgeries, as well as 6 weeks of IV antibiotics. And typically people are left with chronic pain after they have an implant infection. So we do want to make sure that we do what we can on this end of your surgery to make sure it happens at the appropriate time to decrease your chance of having an infection. So basically from this class today, we want to make sure that you can optimize your health. So make an appointment with your family doctor to follow up on any chronic health problems. Go over your thyroid, go over your high blood pressure, making sure that everything has been looked at. We want to make sure that you have no steroid injections in your joint at least 6 weeks before surgery, 3 months if you're Dr. Dooley's patient. And we want to make sure that you have no recent infections, either viral or bacterial, or any wounds on your skin at all. We want to make sure that you're aware about all of these things because if you fail to follow these steps, your surgery can be postponed until your health is optimized. We do want to work with you to have that surgery done as soon as possible, and we want you to do some of this work while you're on the wait list so that it decreases your chance of being postponed when we do come up with a surgery date for you. So there is a person available to help you through this journey. They are the Hip and Knee Navigator. It's a nurse that is available for troubleshooting any issues that might hinder the success of your surgery. And they can also answer any questions that you have. They can also provide you with community resources that might be able to support you or your person to help have a good, quick, safe discharge home. So the Hip and Knee Navigator is available to you throughout your surgical journey, both before and after. You can call directly and leave a message, 250-558-2109, or you can call the hospital switchboard at 250-558-1200 and ask for the Hip and Knee Navigator. There is a few other people you will contact on your journey. There will be the booking clerk who will call you with a surgical date and your appointments, and we need you to let them know if you are going to be away or unavailable for surgery. And their number is 250-558-2105. The surgical optimization nurse will be calling you to review your medical history, and then closer to the surgery date, they will also review any preoperative instructions. While you are on the waiting list, if your health does change, please call the surgical optimization nurse to review what needs to happen next. Their number is 250-558-1311. And physiotherapy will be calling you to book your appointments as far as your post-operative follow-up appointments. If you need to change or cancel those appointments, their number is 250-558-1203. And if you're needing some assistance with the Red Cross forms, the number to call is 250-306-1763. There will be a hip and knee replacement survey that's going out. Just know that participation is voluntary and it is a bit of a longitudinal study. So patients will be asked to complete the survey before surgery and a year after. They will mail you the letter and they'll follow up with a phone call as needed. If you do not want to be part of this survey, we do ask that you contact the IH Patient Quality Care Office at 1-877-442-2001. So this is the end of your surgical optimization class number 1. Please write down any questions that you have or concerns, and when the surgical optimization nurse calls you, they can answer those questions. Thank you for your time today, and I hope you've enjoyed this presentation.